Hello and welcome to week 12. Oh my gosh, only 1 month left in our class. And this week we're going to talk about the end, but not the end of the course, the end of life. But this is very, very important. And regardless of how old you are or how old your loved ones are, you really need to pay attention because we are going to talk about advanced directives. Very, 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 very important. Every person, every adult should have advanced directives. Now, this category of documentation is created by the individual for themselves only. You do not need an attorney. You only need two witnesses who are not related to you. Okay? And you can change it at any time. Okay? So if you're worried about, well, this is what I want now, but 2 years from now, I may not want that anymore. Fine. 2 years from now, you could change it. Easy as pie. You download the form for free from your state's website. Okay. And here are the forms that are included under the umbrella term of advanced directives. You have a living will. Excuse me, we're going to go into all of these in a little more detail, okay? I got the hiccups. A living will, a healthcare surrogate designation, a DNR, which means do not resuscitate, a DNI, do not intubate, and organ donation preferences. Yes or no? Okay, very easy. All right, so advanced directives are legal documents where you spell out your decisions for your own health care. Excuse me, but this is not really about health care as it is end of life care ahead of time, okay? While you're healthy and strong, because we all know some things cannot be predicted. And if you look back over the last year with COVID-19, you may know somebody who developed COVID-19 and had to go into the hospital and maybe was put on a ventilator. One thing for sure is we didn't see it coming. So that's the thing about advanced directives. You say, if I cannot speak for myself, if I cannot communicate, here are my answers as to what I want to happen or what I do not want to happen. Advanced directives must be in writing like all documentation. So you should know that by now. Now, again, we're not talking about handwritten. I'm so sorry. We're not talking about handwritten. We are talking about typed is fine, but it will need to be hand signed. Okay. Each state has its own forms and requirements. Okay. So you need to go to your state's website and put in advanced directives or living will or whatever it is and download that. And it's going to be for free. Okay. Cough drop. And that is very important. Overall, the differences between the states are really minor. Okay. But you want to make sure that if you're going to go through all of this, that your living will, your DNR, whatever, your healthcare surrogacy appointment, is legal in your state. Otherwise, it's not worth the paper it's printed on, literally. Okay. You do not need an attorney. You can ask an attorney if you want, but it's not necessary. So again, it doesn't cost you any money to be able to do this. and some states require non-relative witnesses. Other states may require an actual notary. But so that's another reason why you want to make sure that you follow the rules in your state. Okay. All right. So let's talk about the things that are involved in this. The first is a healthcare surrogate designation. And this names a specific person who can make healthcare decisions for you when you are unable to communicate. Excuse me. This is somebody you really, really trust, okay, to do for you what you want for yourself. Depending upon the state, this may be called a healthcare agent, a healthcare proxy, a healthcare surrogacy, a healthcare representative, healthcare attorney in fact, or a power of attorney for healthcare, or as a patient advocate. And again, it's the same exact responsibility. This is a person who you say, this person can make decisions for me if I cannot communicate. Okay. This person is someone who you want to communicate with, show them your living will, say, this is what I want, this is what I definitely don't want. Okay. And know that they will have the strength to be able to honor that and make that happen for you. All right. If you want, if you choose to not, and we're going to talk about DNRs and DNIs in a minute, but if you choose to not be resuscitated or not be intubated, if you choose to have care to just let nature take its course, you may not want to choose your child or a close relative as your healthcare surrogate, because they may be too emotionally involved to carry out your wishes, especially if they do not understand or they do not agree. Okay. And it's hard to know what a child will feel at this point. Now, we all think about, well, when our parents go, they're going to be 99 years old, and we will have discussed it and it'll be fine. However, we have to remember that there are people going through this every day. There are people dying who were 25 years old, who were 30 years old, who were 45 years old. This death is not exclusively for the very elderly. And that's what these documents are about, is protecting what you want, no matter what age you are. Terry Schiavo was only 27 when she fell into a vegetative state. So this is important, that you have your voice in what you want taken care of. And the surrogacy is for any instances which are not already covered by the living will. Okay? All right. DNR, a do not resuscitate, means no CPR. If your heart stops, everybody stands back and keeps their hands off of you and lets nature take its course. Okay? No CPR, and certainly no electric shocks, like you see on TV. Stand back, boom. None of that. Okay? When the heart stops beating, we let it stay stopped. If this is what you want, then you check that box and you fill out this form, a DNR form. Here, most people in the business refer to it by the initials, and You probably have heard of it by the initials DNR. That's what it stands for, do not resuscitate. No cardiopulmonary resuscitation, no electric shocks to get the heart started back again. Just let nature take its course. Okay. DNI, do not intubate. This is when they put the tube down the patient's throat and have a ventilator breathing for them. I know that you've heard a lot about ventilation over the last year with COVID. They certainly talked a lot about it and the shortage of ventilators and things like this. And again, so you might say, well, it depends on what's going on. How old am I? What are my chances for recovery as to whether or not I want to be ventilated or not? I mean, there are patients who are put on a ventilator for a couple of hours or a couple of days, then they take it off and they're able to recover. And I'm sure you've seen that on television, you know, when they pull that thing out of their mouth. Okay. This is all your instructions. Okay. And again, as time goes on, as you might have a diagnosis or as you turn 95, you may change your mind, and that's fine. You get to change the paperwork. It's really that easy. But this is important for people to decide their own fate. That's in the Constitution. You have the right to refuse treatment. And when you do it now in writing and discuss it with your family, things are a lot easier when and if this should come up. Okay. Comfort care, also known as palliative care. This is used very frequently in hospice. Okay. What this means is that nothing will be done for the patient in an effort to make them better, which at this point might be considered an effort that will not produce an outcome. Okay. This is when any type of intervention will only be focused on reducing pain, therefore increasing the comfort of the patient, while we wait for nature to take its course. Okay? None of this is about euthanasia. None of this is about killing people or even assisted suicide. Not this conversation. This conversation is you deciding for yourself what you want in basic situations, okay? This way, you know, and again, it's not an age thing. I mean, we have wonderful treatments for cancer now. Breast cancer, we have 95% cure rate. Well, recovery, 5 years, okay? But there are still women in their 20s who get who gets breast cancer and die from it. And there are people who are getting colon cancer and stomach cancer and lung cancer of all ages. This has nothing to do with age. This has to do with life. Okay? And the fact that we cannot predict what will happen tomorrow. And we certainly know that, again, in the last year, we saw more than 500,000 Americans die from COVID-19. And that's just in the US. That doesn't count any other country. So this is so important that you realize that we cannot predict, and that just because you're 37, I hope you have a lovely and long lasting life, and you get to be old and decrepit, you know? That's a good thing, but we never know. So you want to properly make sure that you have what you want for yourself. Okay. Organ donation. This is basically a very yes or no kind of thing. Okay. Some people feel very strongly about donating their organs, their bones, their tissues, so other people can be helped. It can save lives. Okay. If you're going to be dead anyway. Other people say, absolutely not. And you know what? We respect both answers. But if you don't write it down, then it becomes an argument with your next of kin. Okay? So why not you decide what you want? And that way, you know what you want is what will be heard. Well, and it will be legally followed. Okay? I don't know that any of us want to have our nearest and dearest standing over our bed during our last moments of breathing, arguing. That's no way to go. You don't want that. This is why we prepare in advance. This is why we make sure that we write down what we want and we make sure everybody close to us understands our viewpoint. Okay? All right. There is also a document called a POLST. It stands for Physician Orders for Life-Sustaining Treatment. Okay? It's the same thing as a living will. However, instead of you, the patient, filling it out, the physician fills it out. And this is intended for people who have already been diagnosed with a serious illness, a terminal disease, and they want to have that extra layer of this is what I want by having the physician himself or herself write these instructions and sign it to make sure that in case of an emergency, you will receive the treatment you prefer or you will not receive treatment that you do not want. This is very, very important. Again, this is free will. This is, as I said, part of the United States Constitution, confirming that you have the right to decide what is done to your body. Whatever it is, you want 3 people to come and jump up and down on your chest to get your heart started again and keep you breathing until they figure out a cure or some kind of resolution for your condition, that's fine. If you're just let nature take its course, leave it alone, I don't want to be a vegetable, you get that too. Whatever you want. Nobody's judgment, just your decision. And we have this ability legally and ethically to take care of now while you're healthy, or the POLST if you're not, to make sure that everybody involved, everybody around you understands what you want so they can accept it and make sure it happens. Make sure you get that exception for that new experimental drug, because we're going to try anything and everything that could possibly help you feel better. Or leave me alone and let me go in peace. Whatever you want. Your decision. But if you don't write it down and you don't do it in the proper way, nobody will know, so they won't be able to follow your decision. And you may not be able to speak or communicate in any fashion. So how can we respect what you want if we don't know what you want? And we don't take people's words for it. You know that already. If it's not documented, it didn't happen. So let's make sure we take care of this. I strongly suggest you do this. You discuss it with your family. If you have parents and other adult members of your family, sit down and discuss it with them. Let them fill it out. I know it's hard to have the discussion, but it's better than not having the discussion. Seriously. Think about your friends, think about your relatives, think about the people you care about and how they're going to be standing by your bedside. And you cannot speak, you cannot communicate. Okay? All right. Okay. This week, chapter 12, 5 stages of grief. We're going to, in the discussion, we're going to talk about the 5 stages of grief, which actually I discovered from a therapist who is a grief counselor. There really are more like 20, and they don't go in order necessarily. They sometimes flip around, and sometimes you go back to another one and then forward, and it's really not this perfect. It's just like an everything all over the place. Grief is very difficult and very personal, very, very personal. So it's important that we understand this not only for ourselves, because no matter who you are, you're going to have to deal with something, but it's also very important because we work in healthcare and you may be around people who are grieving because somebody didn't make it through surgery or someone didn't make it out of the ICU, whatever it might be. It's important for you to understand and for you to gain therapy. And remember, no 2 people go through the same grief, go through the grief the same way, I should say. And that can be challenging, especially when you have family members. Excuse me. Brothers and sisters think that, mom passed away, so everybody should react the same way. And that's not anywhere close to reality. So sometimes you, especially on the administration side of the healthcare facility, can sometimes be a comforting participant in this process to help. Not that you're going to do grief counseling or therapy, you're not licensed for that, but to provide some understanding is the most important. Okay? All right.
Okay.
Thank you. So you're going to discuss in your own words how you might help someone else. It might be a friend of yours, a family member, a patient, a coworker, when he or she is dealing with grief. Somebody has passed away. How can you help them? Okay. That's our discussion question for this week. What are you going to do after you read chapter 12? You're going to do the
Break.
12 homework. Yeah. All right. Additional stuff that I put into the course room is you have a link to it, more information on advanced directives and information on organ donation. I know that some people have a religious tenet about organ donation as to yes you can, no you can't. It's very, very personal, and know that it is a good thing, but nobody's going to say anything if you choose not to. Again, it's a very personal decision. Okay. All right.
Okay.
And I'm here for you. I like your bracelet, Nikki. That is so pretty.
I made them. I
No
make
way.
jewelry now.
Wow.
Yes, ma'am. I make them. This is the gold one. Okay, hold on. This one right here with the C features is amethyst and fluorite.
That's pretty.
Crystal. Yeah, and then this one is rainforest jasper and some gold beads. And this is a mixture of Amazonian, some Howlett, it's a bunch of different ones. Yeah.
Very pretty.
Yeah.
Very pretty. Okay. So this is, if you remember last week we talked about gestation and from the zygote to the baby. And this week we talk about the other end of the spectrum, which is death and dying. And, life is what we deal with. It's healthcare. In healthcare, we deal with the entire scope of things. So, you know where to find me if I can help you in any way, shape, or form, right?
Yes, ma'am. And
Have
I
a
have
good.
a question.
Oh,
I have a
yes.
question. If you could, it's about my chicken certification. If you want to stop the recording.
Okay, I will do that. Bye, everybody else. And